And then, of course, bringing that parent in is really important. And I don't think that students are a lot of times used to bringing that parent in. They're just wanting to say it to the child. And so I think that as an instructor, that's one aspect I'm always trying to bring in, is helping them to include the parent in the conversation as well.
We're going to do as much as we can. We're not going to push them. We're not going to force them if they're hating it. Maybe today is a happy visit with varnish, and that is a positive. That's a great visit for everyone involved. So kind of setting those expectations before the patient's in the chair with the student, I feel like makes the appointment a lot better.
Just take a breath. I think that's one of my biggest things whenever I have a patient who starts, thrashing around, or when I'm giving an injection, when they jump out of the chair. Those moments could be a little scary, even still for me. So when those moments happen, you just take a breath and just go with the flow, honestly.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 268. My name is Andrew.
And my name is Michelle. I'm going to try not to sniffle. I just did like a shot of clear nose spray to both nostrils.
It's been a long time since I've screenshotted our sessions, and that was one I didn't, because I just thought it would be too, I don't know. That's one to get back into, though. I need to start doing that again.
Man, I do love my xylitol nose spray. It's literally a bottle in every room. This is not an ad. I'm just literally telling everybody. I have one in every room.
Speaking of not an ad, on the walk last night, I was thinking I would love to have like a segment of it's called This Is Not an Ad, but talk about the things that I love so much in life. And eventually maybe things would it turn into ads. Maybe they wouldn't. I mean, obviously Rockstar is going to be, a sponsor on the show eventually.
I will cancel A Tale of Two Hygienists.
Because Rockstar gives you more wings than Red Bull does. And it'd be great.
Well, that would be funny, because I was just talking about these cute little bookmarks for any readers out there. So
yeah.
So many random things.
All of those things would be, I don't know. It'd be cool. Like, I'm not getting into video.
But you should, because everyone was so excited to see you on our social media.
Yeah. Shout out to Sarah, our buddy from the UK. But
I take no offense to this, but I definitely know our audience is probably tired of seeing my face.
Well, I mean, look. I'm sure that's true, actually.
It's probably
trying to give you an out, but there's no out for that one.
No, I'm on it a lot.
Well, okay, so this is what we're doing, everybody. Here we go. Actually, Michelle, I don't even know. We don't even talk anymore. I'm so sorry I don't tell you these things. Surprise, there's a thing coming out.
A what? A video?
Hold on. Let me explain it to you first. Just chill. So, everyone, this is what's happening. I'm doing this charity drive thing, walk with bobber, whatever it is. And so what we're going to do is we're going to, I don't like saying this out loud.
Say it.
We are going to have a Marco Polo group for our people that want to be with me on this journey, support me, talk to me. It can only be up to 200 people, so that's going to be kind of limiting. Maybe I can have a group 1 and group 2, but I will talk to you breathlessly on my walk, I guess. I don't know what it's going to look like yet, but I'm going to do regular. No, I know.
Oh my
okay.
God.
Tell me why it's a bad idea.
It's not a bad idea. I just think,
I think it's a horrible idea.
Do you think everyone knows what Marco Polo is?
No, but we have a link. So all I have to do is click the link and it'll bring you it'll sign you up and get you to the group.
Very cool. I'm a big fan of Marco Polo. I literally Marco Polo with somebody almost every day.
Okay. So let's talk about what Marco Polo is, because freaking Michelle is the one that made me do it.
Yes.
Against my will.
Well, I also send adorable kitten videos to your children, and that's mostly why.
They do.
That was the original reason. So Marco Polo is an app that you can send video messages. So just like video text messages. You can say the things you want, and then you can watch it when you have time. It's essentially just, there used to be older ones, like Box was one that I used a long time ago. You could send like audio messages and stuff. well, this is just, I mean, you can do it with Marco Polo audio only, but it's video, and it's just nice to, I mean, it's what I've been using is like traveling before COVID when I was gone half the year. Like, this is how I would communicate with so many people and stay in touch, because I could say like, oh my gosh, I'll have to see this crazy hotel pool. And like, you know, at least they knew where I was and we were kind of connected. So it was nice, but it's great because you can watch it whenever you want. And so it's not like an immediate like FaceTime kind of thing. So anyway, and you can have group messages and go back and forth, and that's pretty fun.
Yeah, my family's picked it up actually too. My buddy Daniel and I do it quite regularly. Like on his walks, he'll do it. He has some really cool trails. Daniel, let me just tell you about this Daniel weirdo guy. He took a train that's not too far from his house that goes 8 miles away, got off the train and walked back 8 miles.
Holy.
That's how dedicated he is to this walking charity thing.
Wow. And eventually he'll probably get to a point where he walks both. 8 miles there.
Well, I mean, if he has time, he's, family man, all this other stuff too. But yeah, oh my gosh.
Oh, public transportation. What a dream. What a dream to live next to public transportation.
Yeah, I thought about that too. I'm like, that is quite a nice little thing you have there, buddy.
Well, we have some dental hygienists that, because I've put on social media, like, does anybody go, because I'll do this on my lunch break. I'll go to my car and that's where I'll eat. And that's where I like answer all my emails. I did that even pre-COVID when I didn't want to sit in a room with a bunch of people without a mask. And I would just eat and just have like a moment to like get prepared for the afternoon, warm up. Usually in the winter time, listen to podcasts I want to listen to. And some people, when I asked, was like, does anybody else do this? Because sometimes I'll get in this car and like, literally I need somebody to come drag me from it because I don't want to go back inside and see the next afternoon of patients. It's like all warm and snuggly. I'm like, I don't want to leave. Yeah. And everybody was like, oh no, we don't do that because we take public transportation. I was like, oh, the beauty of public transportation though. Oh, what a dream.
Mm-hmm. Yeah, it is for sure. I want to switch topics for a quick second. How's Lola doing with her CBD?
Oh, okay. So for our listeners, my ride or die baby girl, my little dog child, is turning 14 actually next month. And she's suffering from I wouldn't say early. I think she's in full blown dementia, like senile dementia. And she's always struggled a little bit with anxiety, and it's just slowly getting worse. Like she hit 10 and thunderstorms became a big thing for her. And I don't know. So maybe was it 2 weeks ago? Like I was like, oh, okay. Like she is showing some serious signs of like pacing, standing at a wall, just like looking at a wall. I was like, oh my God, it's getting so bad. And then I walked in and she was on my bed after I was gone for like a few hours and was like barking at the corner. And I was like, oh, Jesus Christ, this is like so bad. And like my anxiety is out of control because I don't want my child to be upset. So I got at the suggestion of a lot of people, got her some CBD, and it's amazing for her. It's so good. And it tastes like bacon. That's what it says. I haven't tried it, but it says it tastes like bacon. So now she's actually drinking it a little bit from the dropper, which is amazing because I've been shoving pills down her throat for so many years that like she knows I'm coming for her a lot of times and gets like pissy with me. So it's pretty great. What I'm trying to figure out is like how many drops does it do for humans now? Like a little for her, a little for me.
I was going to say like one for you, one for me. Like, oh my gosh.
But I did read that the dose is a lot less for dogs. Like you really can't give human, like, I don't even know, processed CBD, or you shouldn't, to dogs because they do require their dosage is a lot different and the way it's processed is a lot different. Yeah. So I was like, good to know. Glad I asked. So I didn't go buy myself some CBD and was like, a little drop for you, a drop for me.
Smart. Way to be responsible in that particular aspect of your life.
Trying. Well, I mean, I would probably do that for her every day of the week, whereas I'm like, I'll just try it and see what happens.
Oh, Michelle.
I know.
Hey, I got one more thing before we throw it to the interview part of this episode. Have you seen that Hinman, which is coming up in a couple of weeks, is part virtual, part in person?
No.
And so far, ADHA is live, and I haven't really heard about Under One Roof, but I assume that they're probably.
Oh, I'm speaking at ADHA. I keep forgetting to tell people.
I mean, that's in June in Phoenix. And so that's not a whole long way away either. So what are your thoughts on everyone coming back out of the woodworks to conferences?
I'm torn. I think the more people who are getting vaccinated, I think we are starting to see a light at the end of the COVID tunnel a little bit. I know we're always it's going to be amongst us. It's just how it is. I think you and I have seen some horrific behaviors at these conferences, right? Like people not going, like washing their hands, leaving the bathroom, a lot of coughing, sneezing, shaking
One of my
hands.
biggest pet peeves, by the way.
Yeah.
And just rinsing off the one hand for a half a second. I'm like, what are you
These are dental professionals that are also probably on Facebook
dentists,
telling everybody we're the expert in infection control. Like that's the irony that really gets me sometimes. So I think before I make a real opinion about it, I need to see some behaviors of these people. Like if they are like hand sanitizing, they are, wearing masks appropriately over their nose. Like we're being responsible. I think we absolutely can start doing this, especially if we're doing it virtual and in person. And for the love of conferences, I'm so happy we are finally getting into that virtual side. Like the in-person situation was a dying, I guess, way to do it. I don't know the right word, but a dying way of getting that information. And we all saw it. Like if we went to conferences and I'd be like, there's only 100 people at this tiny conference. Like if we made this virtual and did this half and half or this like mixed mode way of disseminating the information, I think you'd have a lot more people attending and hearing this very important information, because there's been some amazing speakers at these conferences where I was at a booth and there was like 100 people. It was so ridiculous. So I'm really happy we're starting to see it kind of become a mixed mode. I'm going to need to see some behaviors. I'm going to need some behaviors first.
Let me throw a counterpoint at you about that. Do you think that because of COVID and the over Zoom meeting effect that we've all kind of experienced, that now we're going to see an increase in number of attendees at a lot of these conferences? So we just need to freaking get out and be amongst our peers. Maybe.
I don't know. I'm like, and I've said this multiple times to multiple people, so if you've heard it before, but and we've talked about how horrible some of the booths and how I was so burned out of being like at a booth at an exhibit, but I would bust my ass on a exhibit floor for one day just to have the opportunity to sit in a lobby bar with my friends and like socialize. Like there'd be so much I would tolerate in life so that I could be with my friends again in that environment, because it was so amazing. And I've made so many great friends across the country because of that. So as desperate as I am to reconnect with people, I am not ready to go walk an exhibit floor. I'm just not.
You're not there yet.
I'm not there yet. People touching things. And I even can't even watch a commercial at this point where people don't have masks on. I feel very like, you're not protected. You're not safe. Get away from them. Get away.
Yeah.
Take care of yourself.
What an opportunity for Germex, though, to be sponsored at every single booth that they can have like a little.
Well, that's the unfortunate part. Not to make this intro super long, but the one thing that has diminished is here in Charleston is hand sanitizer everywhere. That I'm like, y'all, like, yes, masks are super important, but hand hygiene is critical. And like, you just don't see it at every cash register. And I know people are like, oh, the germs are. I'm like, this is not the time to be messing with like we need more hand hygiene in the world.
Yeah.
Put like a soap dispenser and like a little hand washing station in the entrance of places. I think there should be more opportunities to disinfect your hands than just going to the bathroom.
I agree. All right. I think that we have yapped long enough. So in this particular episode, we actually have like a Hygiene Edge takeover, I guess. You and I are not actually on this one. And so the plan, everybody, is that we love everyone at the Hygiene Edge company. And I think one of the things that we want for you guys is to be able to hear more of what they have. And so there's going to be two opportunities to hear them. Every other month, they're going to be doing a shorter tip episode. So if you remember, those ones are the ones that come out on Friday, and it's going to be I think it's going to be geared, they're all educators, so it's going to be more geared towards learning something as an educator or as a student. So I think that's where they're going with it. But then every other month that they don't have a tip episode, they're going to do a full-length episode for us as well. And we are just so thrilled that we get to partner with them on this. If you have any questions, make sure you're please reaching out to them. Let them know that you enjoyed their episode, ask them the questions, and enjoy this interview with Hygiene Edge. Before we get to the interview, we want to say a big thank you to Paradise Dental Technologies, or PDT, for supporting the continuing education portion of this podcast for so many years. If you do not know already, many of our full-length episodes count for CE. You'll find the links in the show notes, or you can sign up for our newsletter by going to atale2hygienist.com. When you sign up for the newsletter, we will periodically send out links to shows that have expiring CE courses attached. And none of this could be possible without the support of the amazing people over at PDT. So check out their hygiene and other instruments at pdtdental.com. That's pdtdental.com. Now, on to the interview.
Welcome, welcome. We are so happy to be here with you celebrating February, National Children's Dental Health Month. And what we wanted to bring to you this February is some tips and tricks for dental hygiene educators in the realm of pediatrics. So Hygiene Edge is here to interview Brittnee Thibault, our resident pediatric hygiene specialist. So we're going to each introduce ourselves in our pediatric expertise realm. And my name is Jessica Atkinson with Hygiene Edge, and I started my dental hygiene career. Well, actually, my dental assisting career. This is before I even became a hygienist, as an assistant in a pediatric office. To be honest, at that time, I thought I was a hygienist. I actually said, these words came out of my mouth. I said, I'm going to go to school and pay so much money to do exactly what I'm doing now, but get paid 3 times as much. Little did I know. I had zero idea what it actually meant to be a dental hygienist. And so we're happy to be here today and tell you why it's important for dental hygienists to be in the pediatric world. I'd like to have Shelley and Melia introduce themselves from Hygiene Edge and their pediatric spin. Shelley.
Hey, everybody. So my background in pediatrics is just working in private practice with lots of patients. And I worked for a lot of offices who see pediatric patients from the beginning, of course. And then I also have had the opportunity for the last 3 or 4 years to teach the pediatric and adolescent class at the school where I teach at. And so I've been able to dive a little bit more into what that pediatric population needs, and then helping students relay that into their clinical practice, because I remind them all the time that when you're in dental hygiene school, you will see 8. I think it's about 8, right? 6 or 8. Very few pediatric patients, and you have to become proficient. And I have to remind myself that those are valuable experiences that they will have in clinic that they need to translate from their class to clinic. So it's really important to be able to know how to treat those little ones all the way up to adolescents. So what about you, Melia?
So I have a 6-year-old, and that's pretty much as far as my pediatric life goes. I mean, I've seen children in private practice, of course, and we see them in clinic all the time. One thing that we do that's really fun and rewarding for me, but also the students at the school that I teach at, is we do rotations at an elementary school. So we see little ones as part of their clinic, which is really fun. And that's a whole other podcast that we can talk about one day, is about outreaching to these populations. I do have a funny story about being at a pediatric office, though. My little one needed her tongue and lip cut when she was little. And I went to this dentist here, and he was very high regarded for laser to get the lip and tie done. And I was very excited to get it done and all the things. Anyway, we show up to the office. He did a wonderful job and was super professional and did a great job and taught me all the stretches and things like that. But when we went to her follow-up, so long ago. It must have been a week after, 2 weeks after. I look over, and a lot of peds offices, they're just like one big room with lots of chairs. And I look over and see, and the assistant is scaling, and I was so upset. So I said something. And so unfortunately I was not invited back to the practice because I said something that the assistant should not be scaling here in the state we live in. So anyway, that's my experience with pedo. So I'm really excited to learn and glean from Brittnee.
Well, it could be a whole other podcast so we can talk about how we stay in the scope of our practice and why you shouldn't have been sayonara'd from that office and maybe something else would have happened, but we digress. We, as Hygiene Edge, are so excited to have Brittnee Thibault here. I met Brittnee in my new position in the school that I work at, and I found out that she is a pediatric dental hygienist. And this made me so excited, and I'm really pleased to have her with us, especially because of my own personal experience where I was an assistant. Granted, I never scaled our patients' teeth. The dentist I worked for was very good at following the rules. However, now on this side of the line, I see that if I were as educated as I am now, I would have been providing those people, those children, with a much better experience. So Brittnee, please introduce yourself and tell us a little bit about your pediatric background and how you got into a pediatric office.
So, I started working as an assistant at this office that I'm at now, actually. I started working there right out of high school. So I was just trained on the job and worked there for a few years. And then I went to hygiene school, worked there a couple times a week while I was in hygiene school. And then after I graduated, I, temped here and there looking for jobs and stuff right out of hygiene school. And then my dentist that I worked for in the pediatric office, he called me and said that they were looking for another hygienist because their other hygienist needed to go on maternity leave. And so he asked if I could come back, and then I've been there ever since. So it's been great. I love this office and I love pediatrics. So
what's crazy is in the state of Utah, it is unusual to have dental hygienists in a pediatric office. It's generally an assistant that's trained on the job doing polishes. And when I was an assistant, I called it prophy. I had no idea what the word prophy meant. And I thought that was just using a rubber cup polish on people's teeth. And it's so much more. So Brittnee, in your opinion, why is it important to have a dental hygienist a part of the dental team in a pediatric office?
There are several reasons that, hygienists can be beneficial for a pediatric office. But one of them first is obviously the scaling and the periodontal care, because you do see that. Surprisingly, you do have children and adolescents that come in with quite a bit of calculus. I see subgingival calculus pretty frequently, severe gingivitis, and those just polishes aren't going to cut it with just prophy cup or polishing cup. So that's beneficial to have a hygienist there to help keep an eye on the periodontal health. They also have me there to help get their patients numb so that they can see more patients. So while they are doing exams, their hygiene patients, the assistants are doing the exams with them, and I am back numbing their patients. And then when they are done, they get to just hop in and get going on treatment. So they are able to get done with patients quicker as far as treatment goes. And I'm also there to help with special needs patients so that the dentist doesn't have to do that. So it takes a lot of the responsibility off the dentist because we are able to scale. We are able to keep an eye on that periodontal health and also help them get through patients faster. So
awesome. From when you were an assistant to now in the same office as a hygienist, how have you seen the difference between the education you offer patients from pre-hygiene school to post-hygiene school?
It is much different. And obviously we learn the motivational interviewing, which is super, super helpful. Before, when I was assisting, it would just be, you need to brush your teeth, twice a day, just telling them what they need to do. rather than using that motivational interviewing to help them come to, a conclusion themselves on why they need to take better care of their teeth. So having the skills, learning the skills to do motivational interviewing has definitely helped. And it also just helps with the patient rapport also, because you're connecting with them a little bit more and they feel more comfortable with you. So I think it's changed quite a bit since I was an assistant, that's for sure.
Yeah, no kidding. Shelley, teaching pediatrics at school, what are the comments that you hear from students in regards to their experiences from being an assistant to what they're learning in school, and how there is often a difference or a mind shift change when they get the didactic information under it?
Yeah, it's the same as what Brittnee was saying. It's I didn't know what I didn't know. I mean, as an assistant myself beforehand, I would do the same thing, the polishes on the child. And I didn't realize that there was also this other category of calculus or tartar to remove. And so students are like, oh, I didn't realize that there was much more than that beyond hygiene, to be honest. So it's the same thing that you guys are mentioning. Yeah, students a lot of times too, they wonder, maybe Jessica, you're going to get to this, but they wonder how to break into these offices to help these offices have a hygienist. Because I recently took one of my children, like Melia did, to a pediatric office, and they didn't have, I asked for a hygienist to be scheduled with the hygienist, and they scheduled me with an assistant, and they didn't even have a hygienist there. So they kind of lied to me. And so a lot of times students want to know, like, how can I guess convince a dentist that I'm worth the extra pay and extra production. So I love that Brittnee said too that you also anesthetize patients. That might be a whole other topic, but like, I'm sure that that's really nerve-wracking for you. Students are they're always concerned about, Miss Brown, I'm really worried about having to give an injection to a child, because that's not something that we do a lot in dental hygiene school.
Forever.
Yeah, we give them to adults.
I never did.
Yeah. So the class, in the class, they just teach them there's a few modifications on depth and amount, and that's about it. The landmarks are the same, but they're always, that first time you give an injection to a pediatric patient, I'm sure, Brittnee, you were like, I've done this before.
Yes, it was like
the first time I was asked to give an injection to a pediatric patient, I bailed. I was like shaking so bad. The child was on a kitty cocktail and was experiencing the Murphy's Law or whatever that is. And it was not a great experience for a first timer. So I would like to definitely talk about what you do to help a student have the most confidence going into that situation, because I had never given an injection on anyone smaller than myself from hygiene school. That is something we don't do, quadrant scaling on a child generally in hygiene school. That I haven't seen it in my 10 years in hygiene education. I mean, I haven't seen it. One thing about Brittnee is she's not only a hygienist and a hygienist in a pediatric office, she also is a clinical instructor at the hygiene school where I live. And as a hygiene educator, Brittnee, what would you tell a student to help them be as confident as possible with these injections?
On a pediatric patient?
Yes, on those teeny tiny heads.
So one thing I have learned is that the way that you describe things is going to affect how the situation's going to go. So if you're going to say, I have to give you an injection, or it'll only hurt a little bit, like those are not, you just don't say that. Those hurt, pain, needle, shot, those are all bad words. So you want to replace those words with things that aren't as scary, like pressure. If, when I need a different needle, I will ask for a tip, not a needle. So you just replace those scary words with things that aren't as scary. Also, something that some may disagree with me on this, but don't really let the patient know what's going on, because if they know that they're getting an injection, especially these little ones, they're going to freak out.
Do you describe it as sleepy juice or?
Yep. You just have to fill out the patient, but most of the time I will just I'll hold my mirror. I'll pull their cheek out with my mirror and say, you're going to feel me shaking your cheek, and I'm going to put a little sleepy bubble right there and it's going to stretch your cheek out. And so it's not quite the same sensation, but it does help describe it in a better way so that when they are feeling something, they think, oh, it's just a bubble, or, oh, she's just stretching my cheek. It's not something scary. So just putting a different, visual in their mind helps a lot. And you don't let them see what you're doing.
I like to say that it's windy. And I always like to have the assistant if I have a little one watching those hands, right?
Yes,
And then
absolutely.
I'll have them blow a little air with their other hand and I'll say it's just gonna get real windy.
Yeah.
So
that I do that also. But yeah, there's a lot of different ways you can go about it. So
there are best practices with children on what to do in order to help with their performance or how they are in the office.
their anxieties or
It's behavior. Shelley came through for me. Shelley, thank you. Behavior management. So you noted one that a lot of people do that you said maybe people will disagree is a tell, show, do. And I would say that is helpful in some aspects, but maybe not in the injection aspect. So I would like to talk about the tips that we have for instructors to help create a successful appointment for the child, the student, and the educator. So let's talk first about what are those best practices like tell, show, do that we can employ in the practice setting for a child. We noted the tell, show, do. We noted about rephrasing. We can talk a little bit more about motivational interviewing. How does motivational interviewing maybe look different for a child than it does an adult? What do you guys think?
it's definitely more simple. You don't have to go into a lot of detail. Actually, you don't want to go into a lot of detail because they can't take all that in. So you just have to keep it simple is kind of what I think, what I try to do.
I like that. I think too, the tricky part about being an educator as well is that, in our clinic, we allow age 3. We start at age 3. Of course, we know that, kids should be seen earlier than that, but that's just, student wise how we work. But one tricky thing is that you're going to treat a 3-year-old much different than you treat a 10-year-old pediatric patient. So those 3-year-olds, I'm always telling the student, you have to have the conversation with the parent. You can tell the child in simple words, but you also need to say, hey, parent, come over here. I need you to brush better here. I need you to brush better here. Here's some direction on what you can do better as a parent at home. But then when they reach age 10, which is still that pediatric patient, I'm wanting the student to look more at the patient and say, hey, you need to brush better here. You need to brush better here. And then of course, bringing that parent in is really important. And I don't think that students are a lot of times used to bringing that parent in. They're just wanting to say it to the child. And so I think that as an instructor, that's one aspect I'm always trying to bring in, is helping them to include the parent in the conversation as well.
I just think the trickiest part of being an instructor with a student and a child is managing all the emotions, right? We're managing the patient, the little one. They might be nervous. They might be chatty. They might be not wanting to be there. And then we're managing the student's anxiety or feelings or trying to get things passed off, or really has to see the whole patient so they can get the credit for it, or, all the things that are brought up in clinic every single day. So that's the tricky part for me, I feel like, with kids, is managing all the personalities and feelings instead of just the patients. So I think just being in the mental mindset of being like, there's a kid here, we're going to do the best that we can, maybe even having a little conversation with the student before the patient's even in your chair. Be like, we're going to do as much as we can. We're not going to push them. We're not going to force them if they're hating it. Maybe today is a happy visit with varnish, and that is a positive. That's a great visit for everyone involved. So kind of setting those expectations before the patient's in the chair with the student, I feel like makes the appointment a lot better.
Yeah, and I think even just filling out where the student is at, because there's some students who are completely comfortable with kids and know how to handle them, and they really don't need, too much guidance on that. But Then there are others who are not comfortable. They don't know how to talk to kids. They don't know how to approach the situation. So kind of even just filling out where they are at beforehand, if they think they're going to need help, or do they need some tips beforehand, or if they're comfortable. I think that's also good.
Yeah, that's a great idea to like open that conversation beforehand. Like, how do you feel about a child? I don't know, maybe some students have never been around kids, right?
Yeah, absolutely.
They didn't have little siblings, or they don't have their own children,
For
so
sure.
yeah, that's a great thing to bring up.
I think to make it a successful appointment for all three is to have a preemptive conversation. This is who you're seeing today. What do you know about them? What would you like to accomplish today? Understanding that those expectations may change as the appointment rolls forward. You may have these grand ideas of what you're going to accomplish on this patient, but once that patient gets there, those expectations may change. One thing as far as managing all of those feelings is when I have a child with a student in my team or in my pod with my group of students, as a team, we're looking at how we can work together to make sure that we are managing our time that benefits each student. So if I have a student with a child, I'm going to try and keep my checks, what I have to evaluate on the student, to a minimum. When maybe another student has somebody in their chair that I can see more often or less often. And that's how I manage that time with a student with a child in order to help with all of those emotions. Any thoughts that you guys have found are really helpful in those situations?
I think just, having a conversation with the team, or even like, if you have a patient, let's say like your group of 4 or 5, whatever your school does, let's say someone has, like a 4 to 6 week reeval, you can kind of be more hands off. Just like maybe take that student aside, be like, hey, we have a 4-year-old over here. I'm going to spend a little more time over there. I hope that's okay, but just come and get me if you need me, so those students aren't feeling neglected. Because sometimes with kids, especially if your students never worked with the child, or the child maybe is not acting as great as they want, and then they're feeling overwhelmed, you tend to gravitate to them and spend a lot more time with them. So maybe just setting the expectations with the whole team, be like, hey, this is what's going on today, and then just go from there. I also think as an instructor too, like sometimes when a kid is super anxious and super not cooperating, and it's a great learning experience, but it might not be a great learning experience to learn how to scale, or a great learning experience to how to polish, right?
Mm-hmm.
So at that, the learning objective...
Let's do a skill evaluation check off here while this kid is screaming.
Yeah. The learning objective for that day for that student is to just handle a child, like experience this child instead of being like, I'm going to have perfect posture today. I know like that's the goal always, but sometimes we need to break down our learning objectives for different patients. So just being aware that maybe our checks aren't as great as they would be with like an adult that'll sit there, but that's okay. The student learned something, they glean from the experience, they'll improve for the next time. That's all we can ask for.
Yeah.
I told my sister when she came down to visit me with her children that she was going to volunteer my flesh and blood to my students so they could have experiences with a pediatric population. So my nephews were patients to 2 of my students, and my sister was completely beside herself when I told her how long the appointment was going to be. And she said to me, she's like, there is no way my children will sit and do the things they want them to do with that amount of time. They will not do this. And guess what? They did. And I want to talk a little bit about how to help parents and children have a more productive experience. In my own experience, it's when the parent is not around. My sister was out of sight, out of mind. And my little nephew, yes, he had a lot of energy, but the student used a lot of really great skills that she learned in class on how to manage his curiosity, gave him things to occupy him while she still was able to get the things done that she needed to, even though it took a lot longer than a traditional 30-minute pedo appointment that they could have gone to a regular dentist for. So I'd love your thoughts on that. Parents and pedos.
Yeah, I remember a parent coming back to me one time as a student and saying, "Aren't you done yet?" Like, it only should take 30 minutes. And I had explained to them already that it was going to be 3 hours and this is the reason why. So that was really hard for me as a student. So I'm always reminding the students, like, hey, make sure that you set those expectations when the child comes in, right?
Yeah, and check in with the parent. I think what was nice is that the student was checking in with my sister saying, you know, this is where we're at, or it wasn't I went back to see where they were at, and I came out and I told the parent, this is where we're at in the process. This is how long it should take from here forward. And I think maybe breaking that appointment down for the parent could be really helpful.
Mm-hmm. I think helping the student recognize that they could be working too on some efficiency things, helping them recognize that, hey, I know you have 3 hours right now to kill and to do a lot of practicing, but we have to get this down to a 30-minute, 45-minute, possibly 1 hour. It depends on the office, right? Appointment here pretty soon. So what efficiency things can we work on? I remember in particular, one instructor, I had a wiggly child. You know, they're wiggly. So students oftentimes leave a lot of biofilm behind. In calculus, they just think I can't get it because they didn't open or whatever. But I remember this instructor vividly looking up at me as I was ready for a check, and you could see the biofilm on those linguals of the mandible, you know, those spots. And I remember her looking up at me and saying, "Shelley, if you don't get it, who will?" And I was like, bing! It's me!
And Shelley, you can get it with a toothbrush, and you can get it with something different than a rubber cup polisher.
I was like, tell me, like, what's more efficient? Like, what's effective? How do I get it? And she just pulled the tongue back, got her fulcrum there, and went 1, 2, 3. And that biofilm was off. And did 1, 2, 3 strokes, 1, 2, 3, and she was done, and it took her 20 seconds. And I was like, wow, that's amazing. You know, I didn't realize as a student, I'm like, oh, they're just too wiggly, I can't get it. But I'm like, I teach students, like, you need to be the boss and just hold the head there for a second and take 20 seconds and do those really good, and then give them a little wiggle break, and then we can move to another area. But I feel like some of those efficiency things.
I wonder if it was the same instructor that said to me, use your I'm in charge voice. It's not a mean voice, but we were doing a series of bite wings on a child, and I had her come and help me because I couldn't get it. The cooperation, the angulation, all of these things. And she came in and she placed it there. She told the child what to, like, it wasn't mean. It wasn't harsh, but it was this is what we're doing. You can do it. And it's going to take this long. And I think that's one of the tips that I'd like to share is the counting. If you can tell a child, we're going to count to 5 and we'll be done. And then all of a sudden I have an x-ray when before I didn't have an x-ray. And so the counting thing is one of those gems. The I'm in charge voice and I'm going to count.
I love that I'm in charge voice because you have to teach that to students.
Yes.
Yeah, don't you think so? Like maybe they need to hear you do it once, and then you seem to be like, you need to show them that you're the boss.
You need that with adults too.
Yeah. I'm going to move your tongue. This is how this is going to work. I do want to say that with what Melia said, it might be a happy visit with some varnish, and it also might be a polish with a toothbrush. I think so often we get in our mind what a certain appointment has to look like, but we can have a child who's used to a toothbrush, and for some reason that little rubber cup polisher is throwing them over the edge. You can be just as effective as removing that biofilm and showing the parent or showing the child what they need to do to remove that biofilm. And that's one of those situations that it's good to have a parent in the op. It's so sometimes yay, sometimes nay, but I swear kids have a little bit of time amnesia when their parent's not there. They don't know how long it's been. But when their parent shows up, they're like, "Oh, it's time to go." So that's my experience.
Yes, I totally agree with that. As I wanted to talk a little bit about what you were saying about, what were you just talking about? Well, one, the counting and the I'm in charge voice. That is come in handy so many times because, for example, when I was training an assistant, she was like really, timid when she was polishing or, just really timid. And I'm like, okay, you have to be very direct with them. You can't be like, oh, I'm so sorry. Oops, sorry. You just have to be, all right, you got this. Nope, you can do it again. We'll try again. Just really, really direct, like you were saying, Jessica. And then what else did you say? I was gonna add on to
Polish with brush.
Oh, toothbrush. Appointments with children are so, you just never know what's going to go on. You don't know if they're going to be happy that day or if they've missed their nap and they're going to be ornery. So just having, we're going to try with a rubber cup polisher. If that doesn't work, try the toothbrush, like you said. If that doesn't work, if they don't want to open their mouth for the toothbrush, then you give it to them and say, hey, can you show me how you brush your teeth at home?
Yeah, I like that.
And then, once they get that toothbrush in their mouth, they're like, oh, okay. I'm like, okay, now it's my turn to brush. And then they're like, okay, yeah, I can let you do that. And sometimes they even let me go back in with the rubber cup polisher. So kind of have to figure out what's going to work for each patient. But, just keep going down the line. Hey, if you don't want to brush your teeth, can mom brush your teeth or anything? And it usually, works out.
Do you put polishing paste on the brush or do you usually just...
I don't at first, just because when they're, kind of anxious and not being cooperative, they don't really want anything in their mouth like flavors. So I don't put anything on the toothbrush. I just let them, if they're going to brush their teeth, I just give them the toothbrush. If they're doing really well, I'll probably just put a little bit of, just regular toothpaste on there. But when kids are like that, I feel like they usually don't like the Profi paste. They
don't like the texture.
They don't like it. Yeah. So I usually don't do that, but it's definitely something you could try for sure.
I think that toothpaste works great too. So
totally.
You can even, hey, we know somebody who really loves dry brushing as well. Like,
as long as you're getting the
well, the goal is to remove, that goal is to remove the biofilm for sure. So those tips and tricks for the child is to use the motivational interviewing, to tell, show, do, our counting. For our student is to have that I'm the boss voice, have an idea of what be a little more flexible on the expectations on how that's going to go in the day, how their appointment's going to go, and kind of leave that open to be what it is going to be. And then for the instructor, shorten those checks, talk to the team, set those expectations. What other tips or tricks do any of you have from your experience teaching students with the pediatric population?
So sometimes students will bring like a little thing for the patient to do while they're waiting, because in school it's such a long check. But if they don't, I like to have like fidget spinners in my kit, my little like stash of pens and stuff. I'll have a fidget spinner or two, just in case like the kid's getting antsy and they need something to do. We just give it to them and it can kind of keep them occupied for a little bit. Depends on the age of the kid, but it can really help them have something to do as we're doing a check or as we're doing paperwork or as we're doing whatever. So sometimes like that, having those is helpful.
Even maybe have, the clinic having a little prize box with little trinkets or whatever. Because, after when kids are having to sit there for a long time or they're having to do something they're not quite wanting to do, having a reward.
A little trinket.
Reward afterwards.
Yeah, that little trinket goes a long way.
Sit there for 3 hours. I got a prize for you. And they love that. So I love that idea of the fidget spinner too. I think one of the other things that I would say, one of the big things is that when you are working with pediatric populations, the whole appointment, the way it's going to go, can start with you and how you first greet that patient and how you talk to that patient when they first arrive or when they first sit in the chair. So it's, with adults, it's a lot of the time, how are you? How's your daughter doing or whatever. But with kids, you can't just, say, hey, how are you doing? Let's go back. You have to be like, oh, did you bring your teddy bear today? What's your teddy bear's name? And you have to kind of connect with them. Otherwise, they're going to feel, more intimidated. And when you start talking to them in their language, they kind of forget about their anxiety, if they have any, or any worries that they have about the appointment, and they feel more comfortable. So don't just jump right in with dental questions, medical history questions.
When was the last time you went to the doctor?
Yes. Sometimes that's how it goes. But with kids, you got to just get down on their level for a minute and just have a fun little conversation before you begin so that they're a little more relaxed.
Yeah, along those lines, depending on the age, of course, I always teach the students it's really important to, utilize what you have, Sometimes we don't always have, especially nowadays. I don't know if with COVID we have toy boxes and things like that or things to share. But, I always tell the student, like, you can give them a ride in the chair. You could let them blow a little bit of air before they even sit down. I don't sometimes like them to use all my tools. Sometimes they get a little crazy with the squirt gun, right? And then as often as possible, trying to be eye level with the child. So like, as soon as the child's in the chair, like you're either like kind of squatted down, looking up at them, or you're in your chair, chatting with them, giving them maybe a little ride. Usually I'll take them up and then down and then back a little bit, then forward a little bit. So they're not like, because it's like when they start leaning back, they're usually pretty scared. So I'll even teach them too sometimes, like you might have to do a lot of this while sitting up, maybe knee to knee. Maybe they will sit in your chair instead of the dental chair. We could try that. We could have two dental chairs and they can sit there while you take a peek, and that would be a good first start. So let's just do what works best for this patient. Make it a really fun first visit, because those first few visits can set up a child for a lifetime of their dental anxiety, possibly. So I'm telling the student, like, this is a really important time. We don't want to push them over the edge by any means. We don't want any tears. We want it to be happy and fun. So anything that you can use around you that you can, like the textbooks talk about changing the names of everything. So I'm reminding the students, like, this is Mr. Slurpee. And, a lot of times in dentistry, we call this the toothpick versus, because they look pointy and sharp. Yeah. Or this is my mirror, and they can look at their eyeball in the mirror. Just changing some of those, adapting some of our tools to be at the level of that child will help make a big difference for the little ones. 10-year-olds, they can handle it, right? They can do it. They have those coping mechanisms to help them be able to get through an appointment. Some don't. Some are a little more extreme, right? But I'm just reminding the students, I've been bit a few times, and that is no fun. But just that tell, show, do, and explaining that and walking the student through those things is really helpful.
I use kiddos' fingernails a lot to show them how an instrument works. And I say, tell me how this feels. Oh, that feels kind of bumpy. Or, oh, that feels, have them explain to you how that's feeling. And I say, I'm going to do the same thing on your teeth. So that tell, show, do piece of making something that could potentially look scary, like a scaler, become much less intimidating. I mean, I think one thing for us is to remind the student that yes, there are protocols and there are parameters that we generally work through, but allow yourself to look for ingenious ways to change that. I've cleaned a kid's teeth standing up, sitting down, sitting at the top of the chair, sitting on my chair, sitting on mom's lap, sitting on the lots of different ways, and being really creative and having them have a good experience. I cannot tell you how many glove chickens I have made. Mm-hmm. But that is, I'll tell you, even if you've got some gloves around the office that don't fit, that everybody hates, make those things into chickens. And then they have a little chicken buddy that can sit with them during their appointment. They can draw eyes on it, and you can make a cute little chicken. So that's my 2 cents. Make them a blood
I love
chicken.
that.
Can never go wrong there.
So Brittnee, I learned something about you at our Christmas party, that you give like hundreds of injections a week to little kiddos, and you did a really great job giving us some tips and tricks. I still feel a little mortified from my very first experience. Gratefully, I've gotten a lot better and I don't have an issue giving children injections now, but I still look back on that moment. There's a feeling of failure from that day. And so what kind of advice do you have for instructors to help prepare our students to meet those challenges? And also not just around injections, but just some parting words for what you've noticed in the pediatric population.
Do you like to use topical too? One time I lost a kid on the topical, they're like, this is terrible. I'm out of here. Maybe address that too.
I would just say take a breath, because most likely your heart's going to be going crazy when things start to go downhill. Just take a breath. I think that's one of my biggest things whenever I have a patient who starts, thrashing around, or when I'm giving an injection, when they jump out of the chair. Those moments could be a little scary, even still for me. So when those moments happen, you just take a breath and just go with the flow, honestly. So that's really what I try to do.
Go with the flow. I would also remind students that they can ask for help. And I was grateful that I was in a situation where I could ask somebody for help when I felt a little in over my head. We have a group of hygienists, a dental team, your dentist, assistants if they need to hold hands of a child, calmly rub their shoulder. Don't ever forget that you're not alone and you're part of a good team. So let's get out there and be confident. Teach students how to be better with that pediatric population.
Well, another great week, another great episode. We thank you all so much for listening each week. If you haven't already, hit that subscribe button, whatever podcasting app you're using. Also, just a reminder, our guests are so fantastic that they love when you reach out. They love when you interact with them on social media. And you can interact with us on social media as well at Instagram or Facebook. We're also on LinkedIn. You can find us at A Tale of Two Hygienists. You can also go to our website, adaleoftwohygienist.com. And we would love for you to go there and subscribe for our newsletter. We have lots of stuff on our website. We have a learning center. You can search for any episode. This is an easy place for you to find the links for our CE courses and take the test. There's just so much more there. So head over to adaleoftwohygienist.com. And if you want, you can also send us an email. I'm Michelle at adaleoftwohygienist.com. And then there's Andrew, who is Andrew at adaleoftwohygienist.com. And we just want to say thank you so much. If you love this episode and you're loving the podcast, we would love for you to subscribe and leave us a review. And, 5-star, go ahead and do it. 5-star, just hit that 5-star and then leave us a review. We really appreciate it. We love reading them. It fuels our fire. And we just appreciate you guys so much. I think that's it, Andrew. Anything else?
Nope, that's it. Have a good week, everybody.
Bye, y'all.